So for the investigations of neonatal sepsis, you still use your SchrDbb algorithm. The SchrDbb algorithm, you start by investigating the disease, ruling out the differential diagnosis and the endemic disease. You investigate for the cause, you investigate for the complication, you investigate for the background, and investigate for the prognosis if you have any. Now, in the investigation of the disease, you use a principle of investigation. That is supporting before confirming. So when you have neonatal sepsis, how do you investigate for that in order to support? To support that is in neonatal sepsis, you have what is called the infectious process, the infectious protocol to evaluate. You have the CRP that you have to evaluate. You have the full blood count that you're going to evaluate, which can tell you that there is a probable infectious process. It is supportive. Now, to confirm now that there's actually a sepsis, we are now going to do a hemoculture. But generally, hemoculture is expensive. It's not directly done in our context. It is only done when you have failure of response of the sepsis to the antibiotics. When you have already taken the patient to 3 to 5 days of antibiotic therapy, and then the antibiotic therapy is not working, that you can do a window period of 24 hours before doing a hemoculture. So that is one indication of hemoculture. But in other contexts, you can directly do the hemoculture because they have money. Now, the next element is a differential diagnosis. Now, the differential diagnosis is mostly the endemic disease. Neonatal sepsis is neonatal sepsis. Does not actually have a differential diagnosis. The differential diagnosis of neonatal sepsis can only be the endemic disease, which is congenital malaria. But now you need to know that this congenital malaria occur in very rare cases. Neonatal sepsis, the differential to that can be congenital malaria, but occurs in very rare cases. And the reason why congenital malaria occur in rare cases is that the malaria parasite generally affect the hemoglobin A, that's the hemoglobin of the adult. But now, in the case of neonates, you still have the hemoglobin F, which is present inside the red blood cells, and the hemoglobin F is not directly affected by the malaria parasite. So it means that generally malaria should come as the last diagnosis in a patient that has an infectious process, because the hemoglobin F is not going to be usually affected by the malaria parasite. Though you can still bring it as a differential diagnosis. Now, the next element after that, now that's in a case where you have an early onset neonatal sepsis. Now, when you have a late onset neonatal sepsis, you need to know that your diagnosis is going to include your point of focus, that you are going to visualize that inside the cause. Is it clear? In the cause, you can have the cause of early onset neonatal sepsis, and you have the cause of late onset neonatal sepsis. For the cause of early onset neonatal sepsis, you say that the mnemonics was gels. Is it clear? And you can do the hemoculture in order to visualize the particular microorganism, and you do sensitivity in order to visualize which antibiotic is going to target them. Is it clear? So that is for the cause. The gels mnemonics, you have already said it. You have said group A, group B, Streptococcus, Escherichia coli, Enterococci, Listeria monocytogenes, and sometimes Staphylococcus aureus. Now, for the late onset neonatal sepsis, we said that we have the point of focus. So for the late onset neonatal sepsis, we said that we have the point of focus, and we need to investigate for the different point of focus. If you have if the point of focus you think that is urinary tract, you do a urinalysis. You can also do a uroculture. If you think that is the GIT, you have to do a stool analysis, and also those other tests will identify if the different types of diarrhea, and then you do a stool culture to visualize it. And then if you have the umbilical cord, you can use skin swab and culture. If you have the skin, you can still do a skin swab and culture. Is it clear? And then if you have the respiratory tract, you can do a throat swab and culture, or you do the ASOT or the ASLO. Is it clear? So that can visualize for the antigens of the immunoglobulins of the group B, group A Streptococcus affecting core, resulting to pharyngitis. Now, you can also do a chest X-ray to visualize for a pneumonia, and generally you need to know that the child cannot cough. So in order for you to do a sputum analysis, you need to remove the sputum of the child with a nasogastric tube at 5 a.m. because generally when the child is going to cough, it cannot be productive. It's directly going to be swallowed into the stomach. So what you do is that at the early mornings, when the child has not yet eaten something, you do a nasogastric tube, and then you collect